Hello, my name is Jackie Perez. I will be co-facilitating this training with Cameron Coleman. Today, as we raise awareness and reduce the stigma of drug-related deaths, today we also want to acknowledge the importance of providing easier access to Narcan trainings, education, and easier accessibility of Narcan kits. COVID-19 pandemic has caused a surge in drug overdose deaths, and we must remind ourselves that we continue to have an opioid crisis during COVID. Social isolation comes with practical dangers, plus added stresses such as loss of jobs, lack of food, homelessness can contribute to the increase of use of drugs. This is why it is our goal to provide more Narcan training and easier accessibility of Narcan kits in the Hudson Valley region. Would you know where to obtain Narcan kits? Well, I'll explain that today. We at HVCS are a certified Narcan provider, and we provide different methods of training. We provide virtual Narcan training. We do face-to-face, definitely keeping that social distancing guidelines. We also do it over the phone. And we also have the availability of providing Narcan kits at our syringe exchange program van, which covers 5 counties. That is Orange County, Dutchess, Sullivan, Ulster, and Rockland. If you need any kits, if you're in need of Narcan kits, if you are reporting that you've used a kit, if it is expired, if you have a friend, a loved one, family member who needs training, we will be able to provide that. And if necessary, we will also provide the delivery. You can give us a call at 845-476-2190. If at any case we are unable to deliver or provide that Narcan kit for you, during the pandemic, what we've done is we've collaborated with different community Narcan providers, such as Team Newburgh, the National Guard, our local health departments, to name a few. And what we've done is, in case that we're unable to provide you with Narcan kits at the time, or vice versa, our other community providers are unable to do that, we maintain contact and we help each other out. So if one person can't do it, then maybe another provider is able to deliver the kits. So we try to eliminate any type of barrier to prevent somebody from getting their Narcan kit. Our goal is to have the entire Hudson Valley with the availability to have a Narcan kit, especially during such an increase in overdoses that we have been experiencing during COVID. Another method of obtaining Narcan would be through NCAP, which is our naloxone copayment assistance program. So in New York State, if you have health insurance, it would cover $40 of your copay. So you could go basically to like a CVS, Walgreens, Rite Aid, Walmart pharmacy, and you would let them know you do not need a script. You would be able to go and obtain your kit, and it would cover $40 of your copay. The next form of obtaining Narcan would be through NextDistro. So if you go to www.nextdistro.org, it's an online mail-based harm reduction platform. So you're able to receive Narcan kits through the mail through them. So now that you are aware how to obtain kits, let me move on to what Narcan is. What is Narcan? So naloxone is a medication that temporarily reverses an opioid overdose. Naloxone is an active ingredient in Narcan. So Narcan is the brand name of the generic drug. Naloxone is available through a nasal spray and an intramuscular injection. I want to emphasize that it only works on opioids, but it is safe to use even if opioids are not present. So if you have a medical condition, the person doesn't know and they administer the Narcan, and let's say it's a heart attack, that will not affect you if they do administer the Narcan. What are opioids? Opioids are hydrocodone, Percocets, fentanyl, heroin, methadone, Tylenol with codeine, OxyContin, morphine, oxymorphone, carfentanil. Also, Narcan does not reverse an overdose that is caused by other drugs such as benzodiazepines, methamphetamines, cocaine, or alcohol. Who is at risk of an overdose? Someone who mixes opioids with either alcohol, pills, or cocaine, that would be a big risk. Tolerance. So if you're exiting the jail or coming out of a hospital, a detox, especially a methadone detox, that could be a huge risk if you want to use and you go back to using what you were the amount of drugs that you were using at that time. Your tolerance has decreased, so that would be an issue. The quality. If you do not know what the quality of drugs is, you're going to a brand new maybe drug supplier. It's important that you test your drugs. Use fentanyl strips if necessary. Another risk is using alone. So behind closed doors, locked doors, where you cannot be found. It's important that you try not to use alone. Leave the door unlocked. Call someone. During a COVID crisis, if we're during a social isolation and we cannot be around people, call somebody, do the FaceTime, stay on the line with the person so the person is aware if they feel like you are having the beginning signs of an overdose. Make sure that Narcan is visible so that they're able to administer Narcan if necessary. Okay, so now I would like to pass it to Cameron, who will continue the next portion of the training. Thank you.
Hi, folks. I'm Cameron Coleman, Education and Prevention Program Supervisor here at Hudson Valley Community Services. Thank you so much to everybody who's attending today and to Jackie for reviewing the first portion of this training. So let's get into it. First thing we'll be reviewing are signs of an overdose. So whether this is someone you know or just someone you stumbled upon, let's review the specific symptoms that you can recognize to determine if the person is overdosing or if something else is going on. Major signs are the person is unconscious, they're not waking up even when you shake them or call their name, slow, restricted breathing that sounds very similar to a snore or a gargling sound, blue, gray, or pale skin color or lip color. Something important to note here is that despite what we've seen in movies, overdoses generally do not happen immediately after using. Overdoses caused by an unexpected dose of fentanyl do frequently result in an immediate overdose. However, in many cases, the overdose can occur up to an hour after using. Depending on the strength of the opiates in the person's body, multiple doses of Narcan may need to be administered. So next, let's get into the steps and how to administer Narcan. So you've identified an overdose and are proceeding with Narcan administration. You've shouted the person's name if you know it. If not their name, just yelling, "Hey, are you okay?" is also fine. Now you see that they're still not waking up after you've shouted to them and tried to shake them awake. We'll move forward with how to use Narcan. So first, we always recommend that 911 is called immediately, as the person may be in need of additional medical assistance when they regain consciousness, or they might not wake up at all from the Narcan, which is why we do encourage folks to seek immediate medical assistance after being revived from an overdose. Make sure when you call to let the dispatcher know that you have a person who's unconscious so that they can get there as fast as possible with EMT services. If other folks are around you, you can point to one specific person and encourage them to call. If not, you can call and put your phone on speaker while proceeding. So now what you'll do is make sure that the person is laying flat on their back. And if this is not possible, then leaned back in a chair can also work if necessary, as long as you're able to tilt their head back. So now that they're laying flat, you can begin to administer the sternum rub, which is when you put your fist together like this, your knuckles out, and then you're gonna rub your chest cavity with your knuckles. So the hope here is that the pain will ignite enough adrenaline in the person to wake them up without the use of Narcan. So once doing the sternum rub, if the person is still not awake, you'll move forward with the Narcan dose. So where other forms of naloxone or Narcan in the past have been intramuscular and required some extra assembly, The nasal Narcan is both twice as strong as the previous dose, does not require any assembly. So there's 4 steps to keep in mind when administering Narcan: peel, place, press, and replace. And for the purposes of this training, I'm going to skip the replace piece, as I know Jackie already reviewed the various ways you can obtain Narcan and who to contact to do so. So here's an example of what a typical Narcan kit looks like. And in case you forget how to administer it, these instructions that we're going to go through are also included inside every sealed dose of Narcan. So first, we're peeling off the packaging to remove the seal. Okay. So once you've removed the packaging, peeled, you're going to take it out and holding the Narcan with your thumb on the bottom of the red plunger and 2 fingers on the nozzle. And then while ensuring that the person's chin is up with their head tilted back, similar to a Flonase or any type of nasal spray, you'll place the tip of the nozzle in either nostril until you feel your fingers touch the bottom of the person's nose. And then once it's placed and you've ensured that the head is tilted back, you'll press the bottom of the plunger firmly to release the entire dose into the person's nose. So now we wait to see if the medication works, which can very often feel difficult to do when someone does not instantly wake up. However, although Narcan isn't harmful, it does sometimes take a full 3 to 5 minutes for the medication to work. And this is important to know because as a result of this, if additional doses are used before the first dose has had a chance to fully kick in, we can unintentionally push people further into withdrawal than they need to be, making them feel more sick when they wake up than they would have otherwise. So while waiting the 3 to 5 minutes, you can provide chest compressions or rescue breathing if you feel comfortable doing so. If rescue breathing will encourage you to use the face shield mask provided in your Narcan kit. And the rescue breathing piece has been deemed optional during COVID-19, so only do these steps if you know how and are comfortable doing so. So if 3 minutes have gone by and the person is still non-responsive, you can go ahead and administer the next dose of Narcan. You'll continue rescue breathing until the person responds or EMT arrives. If the person does not respond and you need to leave them for any reason, you'll want to put the person into the recovery position. And this is where you place a person on their side to prevent them from rolling over and potentially choking on vomit. So to get someone in this position, you'll roll them onto their side with their underarm bent to prevent rolling, top arm with the hand under their chin to keep their mouth open, and then their top leg bent over their bottom leg to support their weight and prevent them from rolling over. So now let's talk aftercare. Narcan takes 3 to 5 minutes to kick in and wears off in 30 to 45 minutes. Now, with that being said, once someone is overdosed and woken up, they won't remember or know what happened. And to their understanding, they might be upset that you just woke them up from what they thought was a really good high. So with this in mind, it's really important that you prepare yourself for the person to be disoriented or upset, and just to explain to them, hey, I just used Narcan and woke you up from an overdose. Narcan only lasts 30 to 45 minutes, at which point you could go right back into an overdose. You'll want to advise the person against using any more opioids, as with the Narcan in their system, they both won't feel the high of the drugs and also are at a very high risk for going right back into an overdose in that time frame. We ask that you stay with the person for at least an hour to an hour and a half, regardless of whether or not they've woken up. However, if you absolutely have to leave, just make sure that you have called 911, and if the person is still unconscious, that they're in the recovery position. So once you've used your Narcan, you can use any of the methods that Jackie had mentioned earlier, including calling the phone number that we wrote on the back of your certificate or certification card if you received your kit from us. So when caring for your Narcan, keep in mind that it's temperature sensitive and is meant to be stored at room temperature, or anywhere from 59 to 77 degrees Fahrenheit. Don't leave Narcan in your car. Your Narcan does have an expiration date that's typically 1 to 2 years. And when possible, if you notice your kit has expired, we'll always encourage folks to replace it ahead of time. But with this in mind, though, all Narcan is good Narcan. And if you witness an overdose and have some expired Narcan accessible, go ahead and ignore the expiration date, use the Narcan. And now, lastly, I just want to briefly review the Good Samaritan Law, what it is and who it protects. So in New York State, the Good Samaritan Law was designed to encourage New Yorkers to call 911 if they witness an overdose without fear of arrest or criminal prosecution for possessing small quantities of drugs or alcohol if underage. This law only protects the person who is calling and the person who is overdosed. So keep that in mind for other folks at the scene in the event that 911 is called. So for those two parties, the Good Samaritan Law protects from the possession of controlled substances up to and including an A2 felony offense, so anything under 8 ounces, possession of alcohol where underage drinking is involved, possession of drug paraphernalia. The law does not protect against A1 felony possession of a controlled substance, so 8 ounces or more, sale or intent to sell of controlled substances, open arrest warrants, and violation of probation or parole. So that concludes our Narcan training today. If you've watched this video and live in New York, you can now consider yourself a certified trainer and follow up with the resources that Jackie mentioned earlier to get your kit and your certification card. I know this was a lot of information, and we're so grateful that you took the time to participate in our event in memoriam of International Overdose Awareness Day. If you have any questions about Narcan, this training, or any additional services provided, please don't hesitate to reach out to us. Thank you so much, folks. And remember, overdose deaths are preventable.